Welcome back to the Victory Education Lounge. I'm your host Maurice, and today we're exploring a topic close to many hearts. Baby's first year, Milestones with Sickle Cell, Part 14. Before we dive into this important journey, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more families navigating this unique path. The first year of a baby's life is filled with wonder, growth, and countless milestones. For parents of infants with sickle cell disease, this journey comes with additional considerations. Today, we'll walk through what to expect, how to celebrate each milestone, and strategies to ensure your little one thrives despite the challenges of sickle cell disease. Have you ever wondered what happens immediately after your baby is born, and the doctors take them away for a brief moment? This is when newborn screening occurs, an essential process that can help in the early diagnosis of various conditions, including sickle cell disease. In those first precious moments, a small blood sample is taken from your baby's heel and sent to a laboratory for testing. The results are usually available within a few weeks. This is what happened to baby Zoe, a beautiful newborn whose screening results came back positive for sickle cell disease. The news came as a surprise to Zoe's parents. They had no history of sickle cell in their family and were initially shocked by the diagnosis. But this early detection was crucial. It meant that Zoe's parents could immediately connect with a pediatric hematologist and begin a preventive care plan for their little girl. The importance of early diagnosis in sickle cell disease cannot be overstated. With this information at hand, doctors can monitor the baby closely for any potential complications. Families can also be educated about the condition, understanding what to expect and how to manage it. Zoe's parents, although overwhelmed initially, quickly learned the ropes. They understood that their little girl would need special care, but they also recognized that with early intervention and the right medical support, Zoe could lead a relatively normal life. Newborn screening and early diagnosis do not just apply to sickle cell disease. They are vital for detecting a range of other conditions that may not be apparent at birth. Early detection means early intervention, which can significantly affect a child's development and quality of life. So, if you're expecting a baby or have recently welcomed a little one, remember that the brief moment your newborn is whisked away for screening is a significant step in their health journey. It's not just a routine procedure, but a potentially life-changing one. Early diagnosis can be a shock, but it's the first step towards ensuring your baby receives the best care possible. What if your baby develops a fever? Do you know when to seek immediate medical attention? These are questions that can keep parents of infants with sickle cell disease up at night. Understanding the early symptoms and knowing how to manage them can make all the difference. One of the earliest signs of sickle cell disease in infants is often a fever. While fevers can be common in babies, for those with sickle cell disease, a fever can signal a potentially life-threatening infection. This is why it's crucial to seek immediate medical attention if your baby's temperature rises above 38 degrees Celsius, or 100.4 degrees Fahrenheit. Let's take a look at Aiden's story. Aiden, a bright-eyed 3-month-old, developed a high fever one afternoon. His parents, who had been educated about the risks associated with sickle cell disease, knew they couldn't wait it out. They promptly took him to the emergency room for evaluation and treatment. Aiden's story underscores the importance of being proactive. His parents' quick response ensured he received the necessary care swiftly, which helped prevent complications. Apart from fever, other early symptoms of sickle cell disease in infants may include swelling in the hands or feet, fatigue or fussiness due to anemia, and jaundice, which is characterized by a yellowish color of the skin or whites of the eyes. Managing these symptoms involves a combination of regular medical checkups, pain relief measures, and preventative care such as vaccinations and antibiotics. It's also important to maintain good hydration and nutrition, as these can help prevent sickling of the blood cells. Remember, each child's experience with sickle cell disease is unique. Symptoms may vary, and not all infants will exhibit these signs. As a parent or caregiver, your knowledge, vigilance, and proactive approach can help manage these early symptoms effectively. Recognizing and acting on early symptoms can save your baby's life. This is why it's essential to stay informed, stay vigilant, and always trust your instincts when it comes to your baby's health. Is your baby growing and developing at a normal pace? How does sickle cell disease affect these milestones? These are common questions among parents of babies with sickle cell disease. Developmental milestones are a set of functional skills or age-specific tasks that most children can do at a certain age range. These milestones can be physical, such as sitting up, crawling, or walking. Or they can be cognitive, such as recognizing faces, saying a first word, or understanding simple instructions. For babies with sickle cell disease, the journey to reach each milestone may look a bit different. The condition can sometimes impact a baby's growth and development, but with the right support, these little ones can still achieve these milestones, though perhaps at their own pace. Take Sophia's story as an illustration. Sophia was diagnosed with sickle cell disease at birth. Her parents were initially concerned that her growth may be delayed due to the condition. However, with the help of a specialized nutrition plan developed by her healthcare team, Sophia was able to meet her growth milestones. She started sitting up independently, crawling, and even started saying her first words, much to the delight of her parents. Sophia's story is a testament to the fact that, while sickle cell disease can present challenges, it doesn't mean that a child's development will necessarily be delayed. It's important to keep in mind that every child is unique and develops at their own pace. And while some babies with sickle cell disease may take a bit longer to reach certain milestones, they'll get there when they're ready. To support your baby's development, it's crucial to keep up with regular checkups with your healthcare team. Follow any recommended treatment plans and provide a nurturing and stimulating environment for your baby. And most importantly, celebrate every milestone, big or small, because each one is a testament to your baby's resilience and strength. Despite initial concerns, children with sickle cell can still reach their milestones, albeit sometimes at their own pace. Did you know that babies with sickle cell disease may need additional vaccines? That's right. Infants with sickle cell disease are at greater risk of certain infections. Therefore, they may follow an enhanced immunization schedule recommended by their healthcare provider to help protect them. Let's look at the Thompson twins story to illustrate this. James and Emma are fraternal twins. James has sickle cell disease and Emma does not. When they went for their 6-month vaccinations, James received a few extra shots. These additional vaccines are designed to provide James with extra protection against potential infections that could be harmful or even life-threatening due to his sickle cell disease. But why are these extra shots necessary? Well, sickle cell disease can make the spleen less effective. The spleen is an organ that helps the body fight off infections, especially those caused by encapsulated bacteria. In babies with sickle cell disease, the spleen may not work as efficiently, leaving them more vulnerable to these infections. The additional vaccines aim to compensate for this vulnerability. Now, it's important to remember that every baby, regardless of whether they have sickle cell disease or not, should follow the routine vaccination schedule. This includes vaccines for diseases like measles, mumps, rubella, and chickenpox, among others. The enhanced immunization plan for babies with sickle cell disease does not replace the routine vaccination schedule, it supplements it. Of course, it's natural to have concerns about vaccinations, especially when there are additional shots involved. It's crucial to have open, honest conversations with your healthcare provider about these concerns. They can explain the benefits and any potential side effects, helping you make informed decisions about your baby's health. So, as parents of a baby with sickle cell disease, remember that you're not alone. There's a whole community of healthcare providers, support groups, and other parents navigating similar paths. Together, you're building a shield of protection around your baby, and vaccinations are an integral part of that shield. Vaccinations are a crucial line of defense in protecting your baby against infections. So, ensure to follow the enhanced immunization schedule recommended by your healthcare provider. How does feeding and hydration affect a baby with sickle cell disease? This is a question that many parents might have on their minds. The answer is simple, yet profound. Proper nutrition and hydration are pivotal in ensuring that babies with sickle cell disease not only survive, but thrive. Feeding a baby with sickle cell disease involves providing them with a well-rounded diet, rich in iron, folic acid, and other essential nutrients. These nutrients are necessary to support the production of healthy red blood cells. Breast milk or iron-fortified formula can provide these nutrients during infancy. As your baby grows, introducing a variety of fruits, vegetables, and proteins will ensure they continue to get the nutrients they need. Fluid intake is equally important. Hydration helps prevent the formation of sickle-shaped cells that can cause painful episodes. As parents, it's crucial to ensure your baby is taking enough fluids, particularly during hot weather or episodes of illness when the risk of dehydration is higher. To bring this to life, let's revisit Maya's story. Despite early complications from her condition, Maya was able to take her first steps at 11 months. This milestone was not just a result of her parents' love and care, but also a testament to the power of proper nutrition and hydration. Maya's parents ensured she was well-nourished and hydrated, supporting her development and helping her body better manage the effects of sickle cell disease. However, it's worth noting that every baby is unique. What works for one might not work for another. Therefore, it's always best to consult with a healthcare professional or a pediatric dietitian who can provide personalized advice based on your baby's specific needs. Proper nutrition and hydration not only prevent complications, but they also support your baby's growth and development. This statement truly encapsulates the importance of these two factors in the life of a baby with sickle cell disease. As parents, by focusing on these aspects, you can play a vital role in helping your baby reach their milestones and live a fulfilling life. Before we wrap up, a quick disclaimer. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Thank you for joining us in the Victory Education Lounge for this important discussion. Don't forget to like, subscribe, and share your thoughts below. Your engagement helps us create more valuable content and reach families who need this information. Until next time, this is Maurice, wishing you and your little one a year filled with joy, growth, and good health.